The U.S. Department of Health and Human Services has extended the public health emergency. This was originally set to expire on July 25th, but the extension is for an additional 90 days. The declaration means that changes will continue to stay in place for hospitals, providers, and states, especially in their Medicaid program, giving a little bit more flexibility. And some of that flexibility we're talking about is things like requiring that insurers cover COVID testing without cost sharing, increased federal Medicaid matching rates, that FMAP that we've been talking about, that comes with a lot of extra protections, like making sure people can't be dropped from the Medicaid roster, to make sure that some premium protections are in place and that some of the coverage can't be more restrictive than it would have otherwise been, making sure people can get and keep their Medicaid coverage during the public health emergency. It also includes making sure that Medicare inpatient payments for COVID patients are at a different rate than they were before the emergency. It includes waivers of some restrictions on things like telehealth to make it easier for people to access their doctor from home. And the length of the emergency itself impacts the amount of shared losses an accountable care organization must then eventually pay back to the Centers for Medicare and Medicaid Services. So a lot of hospitals and a lot of states are happy that this public health emergency declaration will continue. So this flexibility then continues. Now, remember that the public health emergency is distinct from the declaration of a national emergency. It was back in the middle of March that President Trump invoked the Stafford Act to declare a national emergency. When a national emergency and a public health emergency are declared at the same time, states get even more flexibility in their Medicare and Medicaid, children's health insurance program, and even in some of the HIPAA rules that they are then undergoing. And it's because of the way that those two laws interact and the way that it gives flexibility to Section 1135 then of the Social Security Act. You need both the national emergency and the public health emergency for this additional flexibility, and we have that. The extension of the public health emergency means we still have this dual flexibility. Let's go through some of the changes that, because of these dual laws working together, that we will maintain for that additional 90 days beyond the end of July. Thanks to both emergency declarations, the Centers for Medicare and Medicaid Services will have some waivers that continue that will allow bypassing some things like prior authorization requirements, that will allow temporarily enrollment for out-of-state providers. So in your state, you could have an out-of-state provider come in to help. And that's important right now where there are surges in some states where more doctors and frontline healthcare workers are needed. They can deliver care in alternative settings. If you need to start seeking care in a non-traditional setting, the state can then do that if they need to, bypassing some of those regulations. And there's also that continuation of a pause on some of the timing around fair hearing requests and appeal times. Those deadlines have been pushed out. Again, trying to meet that need and that surge in demand in these different settings. We link to a couple things in the description below. One of them is a really helpful article that talks about that emergency declaration be extended, and then a little bit more detail on some of the flexibility granted by these emergencies.